Hi, everyone. Thank you for joining us this afternoon. We are in for a treat. We have Kristin Kanoff, who is returning from last year. Her talk was very well received, so we're repeating it again. She will be speaking on cancer-related cognitive impairments, and I will let her go ahead and do her thing.
Hi, everyone. Thank you for joining us today. I think I'm going to start by introducing myself, just a little bit of who am I. I am a Baltimore native. I grew up in the area. I received my master's degree from Loyola. It used to be college when I went there, but it's now Loyola University back in 2009. And I've been working at Baltimore Washington Medical Center since 2011. I am lucky enough to work with a lot of Tate Center patients. I see patients from the Tate Center for swallowing disorders, speech impairment, and then today we're going to touch on cognitive communication impairments. I am a speech language pathologist by trade. Sometimes I introduce myself as a speech therapist to be a little shorter, but my job as a speech language pathologist is to work with people who have traditional speech and language disorders, social communication, swallowing disorders, but again, today we'll look at cognitive communication disorders. Speech therapists, most of the time when you think about them working with children, but I specialize in the adult population. All right, just to go over a little bit of statistics before we jump into our talk. Approximately or almost 40% of people will be diagnosed with cancer in their lifetime. And as of 2026, which is current, it's estimated that there's going to be over 20 million cancer survivors in the US alone. So those are absolutely massive numbers. So most people signed up for the talk because it focused on Chemo Brain, but the more professional term and the way I'm going to reference Chemo Brain in this talk is cancer-related cognitive impairment, so CRCI. So every year, more than 650,000 cancer patients in the US receive chemotherapy. During their therapy, some of them may experience confusion, lapses in memory, attention, and difficulty concentrating. And it's a constellation of symptoms that more commonly are referred to as chemo brain or chemo fog. But like I said, today I'm going to reference them as CRCI, but that's synonymous with chemo brain. And these are just some comments from patients who have been through treatment. This is how they describe their cancer-related cognitive impairment. It's a literal fog that is separating the question you are looking to resolve and the answer that you would normally obtain quite easily. It's a barrier using your mind properly. It feels as if you cannot remember the most trivial facts or opinions. And then a second comment. It feels like you know what you want to say most of the time, but you can't find the words. I can almost see them in my mind, an object or what I want to say, but the language doesn't come out. It's disconnected somehow. When I was right out of treatment, it included me not remembering what I was doing. I'd enter a room to get to something and I'd have no idea why. I have to go back to where I was and try and redo it. All right. So what are some of the symptoms of CRCI? So it's a cluster of symptoms, and you can experience some or potentially all. It can be poor executive function, and I'll go over exactly what executive function is as we continue with this. Impaired attention or concentration, deficits in short-term memory, and then compromised verbal memory and language. Currently, these are estimates. It affects approximately 30% of people prior to treatment, up to 75% of people during treatment, and approximately 35 people after or post-treatment. What are the causes of CRCI? The cancer treatments themselves can cause the cognitive impairment. So the chemo, the radiation, medications for symptom management, antiemetics, narcotics, anti-epileptics, so those are for seizures, and steroids. But there's also associated factors that can cause some of these cognitive impairments. Stress, anxiety cause reduced attention, nutritional deficiencies, depression, fatigue, and the cancer in and of itself can cause some of these cognitive related impairments. When we go through some of the medications that are known to cause cognitive impairments, we're going to look at narcotics. So those are things like Dilaudid and morphine. That'll cause reduced memory, increased delirium and drowsiness, and the anti-epileptics. So those are anti-seizure meds. So the Dilantin, the valproic acid, that'll cause slowing of cognitive processing speed, reduced attention and short-term memory, and reduced verbal fluency. Moving on to corticosteroids. So those are things like prednisone and dexamethasone. It'll cause reduced attention and concentration, as well as reduced memory. Antidepressants, Cymbalta, Prozac, Risperdal, Effexor, reduced arousal, so reduced alertness, reduced attention, and reduced, or probably it should be increased reaction time or delayed reaction time. In addition to that, it will be reduced word finding, learning, and memory function. So what is my role in treating cognitive related cancer impairment? Some of the domains that I help treat are things like verbal memory, your ability to recall stories and retain them, your conversation recall, your language, which is primarily what I hear is word finding, executive functions, trouble making decisions, prioritizing tasks, and problem solving. These are all skills that you can work on with a speech language pathologist. All right, so when I see a patient that I'm treating for CRCI, the first thing we go through is we validate the concerns. A lot of people will come in and say, I just don't feel like myself anymore. I can't think straight. Am I crazy? And the first thing I say is absolutely not. Everything you're feeling is really valid and normal and somewhat expected. And then a lot of times we spend time validating these concerns to a spouse or a caregiver and explaining that these cancer treatments cause these changes in cognition. And then we talk about the causes and what CRCI is. Like I said, I really involve family and caregivers in our discussions. And then we talk on what compensation versus rehabilitation is. And then I'll go over those in the upcoming slides. I didn't have a good place to put this visual, but I like sharing it with people because I think it's so impactful. That when you have increased stress, it results in reduced cognition. And I can't think of a time that's a whole lot more stressful than going through a cancer diagnosis. So the stress in and of itself is going to cause lapses in memory and impaired recall because you're going through such a stressful time. All right. So the first thing I do when I see patients is obviously we discuss their concerns and what their symptoms are. But once we have a handle on what their symptoms are, we talk about compensation. And these are things that can be immediately implemented in their everyday life. They're simple, practical strategies, but things that maybe we don't think about in the moment. So we talk about taking notes at your doctor's appointments. Gosh, you're receiving all of this new information that might not be presented well, that might be vocabulary you're unfamiliar with. Taking notes is going to help solidify it and allow you to look back on it later to review it and retain it better. Patients who complain of lapse in memories, we talk about utilizing calendars. There's so many appointments when you're going through cancer treatment. There's got to be a better way than trying to hold all of your appointments up in your head, and having that calendar, whether it be a date book for some of us that don't like technology, but perhaps for some of the younger patients who are very tech savvy and have cell phones, we can use the calendar apps in our phones. Alarms, reminding you 15 minutes before your appointment, hey, it's time to get ready to leave the house. We need to get going. Minimizing distractions. If you are taking in new information from a family member, from a doctor, you don't want your phone ringing. You don't want your text messages going off. You don't want the radio going in the background. You need to minimize the distractions to attend and retain better. So these things are that we can immediately implement. We can talk about, we can list them out in that first session and talk about implementing them immediately and incorporating them to help compensate for these deficits that you're currently experiencing. Then we get in the next couple of sessions to the rehabilitation piece. So trying to work on these skills and improve them. Again, these are things, some of these things aren't as effective as others, and we have to go through the list and determine what are effective strategies for you, or what strategies match your constellation of symptoms. So we may go over your verbal memory and how to improve that. When we're talking about memory, I highly encourage patients to utilize associations. We might go through mnemonics. We'll talk about work on language skills. I may focus on circumlocution, which is like looking for the right word by describing. We'll work on executive function skills. I talk a lot about metacognition, so that's thinking about your own thinking and assessing your progress and how you can make it better. Or sometimes we go through task analysis. So generally, number one complaint when someone comes to see me is my memory isn't as good as it should, or my memory wasn't as good as it used to be. And the first thing I always go over are memory aids. So memory aids, a lot of people use them to begin with. I certainly do. I need them. I have 2 little kids and I work a full-time job. I cannot remember all the things I need to do in a day, in a week, in a month. So I am trying very hard to use my phone, but there's a piece of me, despite being a millennial, that still likes a pen and paper or calendar. There's something really satisfying about writing it down and crossing it off. So I use a bit of both. But, you know, I use my calendar to maintain appointments and birthdays and anniversaries and practice schedules and deadlines. I certainly use a shopping list. I cannot remember everything my kids want that week. So using memory aids are normal. Sometimes we kind of fall off using them, and that's the first thing I kind of encourage people to get back to find this external memory aid and implement it in your everyday life. What can you do? It could be an alarm, it could be timers, notebooks, date books, calendars, medication dispensers are big. We want to make sure that we're taking our meds daily at the prescribed times. Sometimes journaling is nice. And then, like I said, if you were tech savvy, smartphones have so many applications and functions that can be helpful, but you have to be comfortable using them. Otherwise, there's no point in starting. I also go over internal memory aids. So these are things that you cannot touch, that are not tangible, that we're going to use our brain to utilize. So things like associations. So linking new information to something you already know is a lot less burdensome from your memory versus trying to create a completely new space for this new information. Sometimes first letter cueing, rhyming things, categorizing it. You know, if you write down your grocery list and you do it by department in the grocery store, it could be helpful. In some cases, mnemonics are helpful. And this is my favorite one because I learned this back in graduate school. On old Olympus's towering tops, Finn and a German viewed some hops. And that's how I learned in grad school the 12 cranial nerves. So in some cases, there is a role for mnemonics, and it hasn't left my mind for the past 18 years. Second largest complaint I get when I see patients going through or post-cancer treatment are word finding. I can't come up with the right words in a timely fashion. So it's a lot of people describe it as a tip of the tongue syndrome. You know, you have the word in your head, but it won't come out when you need it. So in speech, we'll work on some exercises to practice word retrieval or work around and find that word when you need it. The goal is to have you feel more confident when speaking to others. All right, strategies to combat word finding difficulties. I personally find using descriptions is probably the most helpful strategy for myself and many of my patients. It's when you know the word you want, but you can't quite get to it. If you were going for cat, you would be like, oh, it's not the dog. Oh, they're small and fuzzy and they have a long tail. They use the litter box. And sometimes in and of that act of describing it, you're going to talk yourself right into the words you need. Sometimes you can come up with the first letter. Oh, it starts with the letter C, and you look at your friend, your loved one, and they can kind of help you work through it. Sometimes you just need a pause, which is hard because we all feel the pressure when we're talking, especially to doctors. We feel that like, oh, I need to get it out. I can't waste their time. But sometimes that deep breath, that pause, that reset will allow that word to come to you. Sometimes you can look for a word related to your target word, and it might be good enough or sufficient to get by. So all of these things can kind of combat when you're stuck looking for that correct word. So some things you can do at home to work on word finding skills. I think board games are great. They're fun, they're low pressure, they're a family game, they're something to do with family or friends. Some that work specifically on word finding are categories, taboo, hues and cues, and apples to apples. You can also look at, I had a student who was really into Wordle, looking for like the right word and building words off the letters. Crossword puzzles, connections, those are great. But I mean, you can walk around the house and just name things, or as you watch your television show, you can try and challenge yourself and label the actors or what other movies or television shows they've been in. Scrabble, words with friends. There's even specific computer apps that help elicit word finding. They're not going to cure your word finding issues, but it will help you practice that skill. All right. Something else we find that can be impacted by chemo is attention. So what is attention? It's the ability to focus on something. To listen to a conversation, to follow it. Intention is so important because it's the first process that has to happen for your memory. So if you are distracted in conversation, you will not remember the conversation. That the attention is so incredibly important. So this is something we work on and build awareness with. There are certainly different types of attention. Sustained attention is, can you just sit here and listen to me talk? Hopefully the answer is yes for a while. But if I was giving a 4-hour talk, perhaps you might zone out and tune me out after a while. There's also selective attention. So what you online probably didn't hear is, can you keep listening to me, but we just heard a siren go by. So can you tune out the ambulance or the fire truck coming to the hospital and continue to listen to what you should be listening to? And then there's the highest level of attention, which is divided attention. And can you do two things at once? The example here is listening to the radio while driving your car. So can you sing along to your favorite song, but still give enough appropriate attention while you're driving your car? What can you do to make attention better? You can break the tasks into more smaller, manageable steps that help maintain attention. You want to reduce distractions. Again, if you only have so much energy, you want to turn off the radio, turn off the TV. You want to set your cell phone away from you so you're not getting the buzzing constant updates. Taking short brain breaks help prevent fatigue and reset focus. I know that I can only listen to somebody talk for a certain amount of time. When we go to conferences, I can sit for about an hour and then I need to stand up and I need to reset. Otherwise, I'm not going to retain any new or additional information. Setting specific goals for what you want to achieve to make it easier to stay on task. Today's tax day. So if you were doing your taxes, you're going to say, I'm going to sit down, I'm going to work on this for 30 minutes. And then I'm going to get up and I'm going to go to the kitchen and get a drink of water and a snack. And then I'm going to come back and do it for another 20 or 30 minutes, knowing that making those small, manageable pieces will improve the attention because you know there's an end to it versus sitting there and toiling away on the taxes for 4 or 5 hours, but actually ending up wasting time on your cell phone. All right, so how do you improve? Some things you can do at home for attention. Sorting tasks. They help you focus. your selective attention, identify features of objects, and keep track of where they are. So you want to be organized. Organization helps with attention. Jigsaw puzzles help with sustained attention. And again, I don't expect you to do a 1,000-piece puzzle in one day, but you might sit and work on it for 20 or 30 minutes and just focus on that. Group conversations require a lot of divided attention where you need to listen to multiple people, process the information. Cooking is a alternating attention task because you might be boiling water for pasta, but also sauteing some onions in a pan. Can you move between the two and not burn the onions or overboil the water for your pasta? Executive skills are impacted, but let's talk about what executive skills are first. Executive skills are the brain's control center. They help you manage tasks and make good decisions. Think of them like the tools you need to follow, plan, and make adjustments when things don't go as expected. These skills help you start a project, stay focused on it, and switch between tasks and solve problems along the way. So this is our highest level of cognitive function. What are some strategies for improving your executive skills? To-do lists are wonderful. It keeps track of all of the things you need to do, and you can check them off as you go. Again, if you are tech savvy, there are lots of goal tracking apps. Sometimes using alarms or reminders help you to stay on schedule or help you initiate tasks. Sometimes people feel like they have a hard time getting new tasks started. Having a structured day helps reduce the mental effort you need for decision making. We make thousands of decisions all day, every day. Sometimes using a priority system like urgent, important, or low priority helps you prioritize your tasks and set up throughout the day. So that's what I'm going to show you next. I really like this when I do this in treatment with my patients. It's called the Eisenhower box. And we'll sit down and we'll list maybe all the things they need to do for the day or the week. It depends on how much my patient has going on at the moment. And we take that list of to-dos and we rank them via the Eisenhower box. What is important and urgent that I need to do today or this morning? What is something that's important, but I don't have to get done the next day? That goes into the decide. What is something that I need to get done, but it's not super high priority? Can you delegate that to a family member or a loved one? And then what is something I'd like to get done? I'd like to organize my sock drawer. That would be great. But maybe that's not the highest importance or something urgent. We might delete that off the list and leave it for another day when we're feeling better. How can you improve executive skills at home? Meal planning is great. Making a shopping list to make sure you have all the ingredients for your meal plans. Organize your kitchen and ingredients beforehand to make sure you have everything ready, because there's nothing worse than getting halfway through a recipe and realizing you don't have an ingredient for it. Playing strategic board games gives you an opportunity to practice executive skills. Chess, checkers, Sudoku, card games, they require you to think ahead and make decisions and adapt based on changes. You're going to practice making quick decisions in small, low-stakes situations. So in the moment, deciding what you're going to have for dinner, what movie you want to watch, or which route you're going to take to the store. Practice choosing and reflecting on your decision. So even planning the route to the store, you can take, I don't know, Ritchie Highway or Baltimore Annapolis Boulevard, and then you take it and you're like, you know what, this wasn't a good choice because it was the time the kids got off school and the buses were in the way. If I do this again, I'm not going to take this route because the buses were in my way. So kind of that self-evaluating feature. Other skills, creating a simple budget for your monthly expenses. You track your spending, categorize your purchase, and find your way to reduce unnecessary costs. Is there a way, Lindsay, to see my notes? I had handouts and I left them on my desk. There.
Can you see it? You're gonna see it on the screen. Yeah, if you don't mind, I could stop sharing if you need me to stop sharing.
I just want to, I wanted to touch on spoon theory. I want to make sure I give credit to the creator. So it's spoon theory is something I touch on with people who particularly are during treatment and they feel like they have limited or low energy. And it was a metaphor created by Kristin Mr. Randino. And when you wake up each day, you have a certain number of spoons, and these spoons in this metaphor represent your energy. And day to day, all of us wake up with different spoons. On a good day, we might have 12. On a bad day where you have high pain or a multitude of symptoms, you may only wake up with 3 or 4. So you have to decide based on what you're feeling that day and how many spoons you wake up with, how to expend your energy that day. You don't want to avoid crashes. When you overexpend these spoons and you take from what you don't have, it may mean the next day you have even less. So we talk about kind of energy management and planning and being successful when you're having a high pain day or a high symptom day. So let's see, slide. So how to use the spoon theory. So each morning you're going to wake up, you're going to estimate how much energy you've woken up with. Today was a good day for me. I'll say I had full 12. And then you estimate your total energy and how you're going to break it down into mental energy, physical energy, and emotional energy. So you're going to plan your day. You're going to write down all, as we talked about, planning helps with your day efficiency and your attention and your executive skills. So now you've planned your day. You're going to write down or check off the activities you want to accomplish that day. And then you have to plan it when you take into how much energy you have for the day. Make sure to pace yourself, take breaks, lie down, sit down, do restful activities, nap, meditate, pray, based on how you're feeling that day. So you do the math. Did you wake up with enough energy to do everything you want for the day? If not, maybe you need to modify the activity. So you were going to go grocery shopping, but you woke up and you don't have enough spoons to go grocery shopping. Can you order online? Can it be delivered? Or can you just go pick it up and not walk around the grocery store? Can you postpone the activity to another day? Can you break an activity into pieces and only do one part of it? Can you delegate? Do you have a family member that can help you do something? Remember, you need to prioritize and you only do what's within your energy budget for that day. You may have to make decisions or risk a possible crash. So doubling back, you need to manage your energy for what you can or cannot do in that day is kind of the take home message. I do want to touch on a couple other things. Other brain health considerations. You want to get moving. When we're talking about cognitive function, all of these things impact your cognitive functions along with the cancer treatment. If you are able to, any aerobic exercise that elevates your heart rate is good for well-being, body and brain health. You want to eat well. What you eat affects your energy, your mood, your activity. There's a connection between your gut and your brain, and your diet impacts your brain health. You want to train your brain. Your brain is like a muscle, like the rest of your body. Regular workout can help ensure it functioning better, and introducing new challenges can help stimulate your brain. Connections with others. You don't want to isolate yourself. We are social creatures by nature, and our brains thrive on mentally, emotionally, and physically in the presence of others. So you want to make it a point to go out, see friends, see family, and maintain your relationships. Sleep is so important for cognitive function and brain health. The better you sleep, it helps boost your memory and boost your immune system. So do your best to get your rest. You want to monitor mood. Again, mood changes. We talked about stress negatively impacts cognition or memory. So mood changes such as anxiety and depression are linked to memory and thinking changes. So if that is something you're experiencing, I highly encourage you to discuss that with your provider. All right. So in summary, unfortunately, the number of people with CRCI or Chemo Brain is growing, and it is an underserved population. I only see a handful of these patients each year, despite the fact that a lot of patients experience these constellation of symptoms. But there are services like speech therapy that are available to help and improve your impairments. This was kind of like the final thought, something from one of the cancer patients that they had said. The biggest thing health professionals can do is validate these things that are happening. You know, I can remember things healthcare professionals have said to me, and the most moving, the most powerful thing you can say as healthcare professionals are, I'm sorry this is happening. This is a big diagnosis. How are you handling it? The times I felt validated made my stress and anxiety go down, and I felt heard. So this all kind of comes back to what you're experiencing is very valid and very real, and there are ways to combat it and be proactive. Otherwise, thank you guys so much for listening, and I'm open to take any questions or listen to any concerns.
See if there's a way for me to unmute people.
I'm just going to see if she can unmute anyone, or you can go ahead and type it into the chat. Next one.
And then we currently have displayed some information and a thank you for your participation today. If you have feedback for Kristin or for any future survivorship events, you can scan the QR code on your screen. And then there is a flyer for the next one that's coming up, Survivorship 101 in June. That's going to be facilitated by our very own Kai Andrews. She's fantastic, as well as Kristin. And she will be presenting on survivorship care plans and what you can kind of expect as you're going through treatment and beyond. And I will try to unmute people, but if you do have questions, you can also type them in the chat. Michelle is asking if we could show the Eisenhower grid.
Sure.
Again.
There it is.
Thank you. I don't know if I'm able to unmute people. Okay. Kelly would like to know if there's a specialized training for speech pathologists, or do most get trained in this?
No, there isn't specialized training. I personally have taken a lot of continuing education classes on this particular topic.